Great. Thank you, everyone. Welcome to our weekly Tuesday Democratic Caucus. I'm just going to put a little plug in for the Philadelphia Eagles. I heard that made my weekend. I heard this morning, a couple updates. I heard this morning that the mezzanine construction is complete and that committees are going to be moving. So it's GovOps and Education that will be moving there. And then there still has to be some work done on rooms 10 and 11 before we can move this caucus back there. But stay tuned for that. So that's pretty exciting. A couple other announcements before we get into our topics. If you're going to be absent from the building, please let leadership know for any length of time. Our floor times are going to stay 10 on Tuesdays, 3 and 3 on Wednesday, Thursday, and 9:30 on Friday for the foreseeable future. This Friday is the last day for submission of standard form bills. You have until February 21st to approve the bill for public release. And obviously short form bills, which are a great thing to use, are available to you anytime. The speaker soiree is February 13th at the Alumni Hall at the College of Fine Arts. The theme is Elevating the Voices of Tomorrow. And you've all received an email and a link for a ticket, so hopefully we will see everyone there. Crossover dates, I'm not sure if we've said this yet. March 14th is the policy crossover, so all bills will have to be out of the policy committees. And then March 21st is the crossover date for money committees. Events this week, we have the governor's budget address today at 1 o'clock, so please be in your seat 10 minutes early. And on Thursday at 5 p.m. in the House chamber, we have a Bring 'em panel, which I think will be extremely interesting to hear from some experts and then have the ability to ask questions. So I hope everyone can attend. So today we have 4 topics. The weekly education update. We're going to hear from Judiciary on H27, an act relating to the Domestic Violence Fatality Review Commission. We have 2 bills coming out of healthcare this week, H35, an act relating to unmerging the individual and small group health insurance markets, and H31, an act relating to claims edits and prior authorizations. And then we're also going to have hopefully Rep Wood and Rep Shy come up and do a child care update. So I think we're going to start with education. Peter and Emily.
Good morning, everybody. Peter Conlon, Chair of the House Education Committee. We're very excited about our move to the mezzanine. We don't know why it's called a mezzanine. And if you'd like to come visit us, you'll have to get directions from somebody because I didn't know the space existed until 3 or 4 years into my service here. But anyway, we're looking forward to that and come see us. And please do put the panel. Oh, thank you. Please do put the panel on your calendar for Thursday. It should be really interesting. Herb Olson has done just a great effort to make this come together with a great panel. He will be moderating. Looking very much forward to it. In terms of education, on the one hand, we are still awaiting details from the administration. They laid out their schedule for sort of unveiling those details last week, and the policy type things and the sort of the statutory language that goes along with it. It's going to be another week before we really see that in detail. However, in the meantime, we are continuing to get ourselves grounded this week. So for example, today we're going to be spending quite a bit of time just talking about what does it take to redraw district lines, or what does it mean to have larger school districts. It's not just as simple as redrawing lines. Like, for example, there's nothing in state statute that allows for different educational delivery models within the same district. So how do you address that? Later in the week, we'll be talking a bit about funding formulas that Emily can expand upon a little bit more. But anyway, we just continue to do that. We continue to dive into our own initiatives, our own policies. One of the holes that I think will be in the governor's proposal that we've seen so far, in that school construction. But everybody seems to agree that you can't have transformation in Vermont in education without also having a robust school construction program. So we need to continue to address that. Anyway, Emily.
Thanks, Peter. In House Ways and Means, we are similar to House Education, diving into the fundamentals that underlie the governor's proposal while waiting for final policy details. and drafting. Want to be very clear that a good education finance system needs to be designed around a quality governance and delivery for all of our kids and our families. And so we are going to be taking our time, working closely with the House Education Committee and the Senate, making sure that we are all working in coordination so that as they are making policy decisions, we can make sure that an education finance system that we are working on will meet the needs of our children both today and tomorrow. This week, partially jointly with House Education, partly on our own, we are taking testimony on what are the fundamentals of a quality education finance system, and then diving deeper into what are the fundamentals of a quality funding formula, that quality foundation formula. In doing that, we are hearing from a pretty incredible series of national experts, both in terms of direct testimony, and then we're doing some side reading and having group discussions.
Everybody knows that.
Yes, yes. Good to meet you.
Nice.
Sometimes I don't know if it's in my head or actually happening, the noises. Probably shouldn't have said that on the mic. Really encourage you, if you want to get a grounding in the work ahead of us, these are the times to really be tuning into our committees, because we're really laying the groundwork for what matters, how we're going to be making the decisions that we're making, including that really incredible panel on Brigham that Herb Olson put together. So really encourage you to attend that as well. If you are not able to make it to the panel on Thursday, you don't need to let me know. That's okay. Just be there or don't be there. Looking forward to seeing if you can make it. Thank you very much. No, you cannot. Oh, but
Right, it's got to be recorded. I remember Martin Lone, South Burlington representative. Is this going to be recorded? So if we can't make it, we can see it another time? Or do you not want to suggest that so that people don't show up?
it's really nice to have a full room out of respect for the panelists, and it makes everything feel richer. There's an opportunity for questions that's built into the panel. And so that will be available too if you are there. But we are also, Peter invited the local public access station to also record it. One other sort of highlight of the week is, as you might know, we're getting the governor's budget address today. That will begin a conversation in both of our committees about both sort of short-term spending on education related to tax rates, as well as the beginning of some longer-term spending focused on transformation. And so we will begin taking testimony on that this week as well.
Thank you.
And I realize I never introduced myself when we start this. So I am Lori Houghton and I represent Essex Junction. Next, we have Representative Lalone and Rachelson up to talk about H27.
If I need to phone friend, I think Martin's coming up. Hi, I'm Representative Barbara Rachelson from Burlington, and I am going to talk to you very briefly about H27, but happy to fill in more detail for anyone that would like that. So H27 makes some changes to our current Domestic Violence Fatality Review Commission. The last time that changes have been made to this commission was back in 2009. The changes that are being made were initiated by the commission and the Council on Domestic Violence that works closely with the commission. You'll note from looking at the calendar that our committee amended the bill. It is not a strike all, so you'll have to toggle back and forth between the bill and the short amendment. So I'm not going to say too much about what the Domestic Fatality Review Commission does, but they have an important job in analyzing deaths that have occurred that are related to domestic violence. Those could be suicides or homicides, and steps that could occur in order to prevent future ones. a little bit less than 50% of the homicides in our state are from domestic violence related homicides. So we still have plenty of work to do. So what are the three changes that are happening? One, we were asked to add near fatalities to the charge for this commission. There are a bunch of other states that have added near fatalities. And we heard from witnesses who talked about why that's important. One, in those cases, there was some quirky reason that the person didn't end up dying, but they're just as serious. And two, we have the unique opportunity to hear from the victim in those cases who has a lot of rich information that we cannot get from the people who were actually successfully murdered or committed suicide. So that's one change. A second change is to expand the membership of the commission. The commission currently has 19 members that are spelled out in the legislation. They're either appointed by the body that they represent, like the state attorney is appointed by the state attorney and sheriff association, etc. So the three members that the original bill, and then we added a couple more, are a sheriff, because while we have state police and we have a local law enforcement officer who happens to be the South Burlington police chief, sheriffs have a unique role. One of the roles that they have is helping people move their things out in domestic violence situations. Some sheriffs do investigations. And it was felt that having that sheriff perspective was also really important. Even though the commission is currently 19 and we'd be making it 23, it's very interdisciplinary. And that's really important because the different perspectives that come into play are unique and really help to try to holistically change the system. So sheriff is one. You will remember, some of you, that maybe last biennium, maybe two bienniums ago, we added that community justice centers can get domestic violence referrals. So one of the members that would be added to this commission is somebody from a community justice center that has worked in the domestic violence world, which is great. I was actually at my Burlington Parallel Justice Committee meeting yesterday, and they were thrilled to hear that. And then the other two members that I'm doing math in my head, so that's why there are more than three, are adding the DOC victim program coordinator, who is currently an alternate. But the commission felt that they should be there in addition to the Department of Corrections being there. Same thing with the commission wanted one of the non-confidential victim advocates that work in the state attorney's offices to be on there. And in the original bill, they asked the Center for Crime Victim Services, which used to manage them, to appoint it. And our committee discovered one that the Center for Crime Victim Services is missing. They are not represented on this commission. So in our amendment, we add the executive director for the Center of Crime Victim Services. And the executive director pointed out to us that she does not have the authority to appoint the state attorney to that committee. So the amendment changes that language to have the state attorney and sheriff association make that appointment. The third change is adding language in the legislation that asks the people who are charged with appointing the members of the commission to consider diversity in making their appointments. And again, we know that's important, especially we heard this a lot when the courts went around and talked to victims and the public of when people come to court or getting services, if there's nobody that they see that feels or looks like them or has a similar um whatever their diversity is, they're not what people are we're not seeing that when they came to court and worried about is justice really being served. So same thing with victims. We want to make sure that victims know that whenever possible, diversity should be a factor. So that basically is what the bill does, and it would take effect on passage, and it won't cost anything more. And hopefully it will help us reduce domestic violence crime in our state. Yes, thank you. It was voted out of our committee by a vote of 10-0 tomorrow. Yes.
Any questions? Thank you. Thanks for the good work. Sounds like strengthening that panel will really help victims of domestic violence in Vermont. So that's great work. Next, we're going to have Representative Black up to talk about 2 healthcare bills.
I have 2. Overachiever, I think. Representative Black, I represent Essex, and I'm chair of House Healthcare. So we have 2 bills coming up this week. Up for action. I'll start with H35 first, which is up for action tomorrow. H35 is permanently unmerging the individual and small group market. A little history, I guess I'll go into, and stop me if you've heard this before, because we've done this almost every year, it seems like. Originally, after the Affordable Care Act establishing Vermont Health Connect, it was felt to protect the individual market. Those are people who purchase on the exchange, an individual. They're often higher costs to insure. It was felt to make the pool larger, that they would include the small group market with it. The small group is made up of small employers who purchase qualified health plans. Small employers under 100 people are considered that market. The markets are about equal number of people in them. It was felt to sort of spread out the risk, that they would merge those 2 markets together. Fast forward to COVID. And the federal government had increased the advanced premium tax credit for people who purchase on the individual market, which sort of protected them from any increases. And so at that time, we did legislation to unmerge the markets because it would lower the cost of the small group market. We really have no levers to be able to help the small group market, small employers. And this was felt to be advantageous to them while at the same time protecting the individual market. We have continued keeping it unmerged over the past few years. It currently is set to sunset on December 31st of this year. And what this bill does, H35, is it is going to make that unmerging permanent. This will protect the small group market. I think estimates from AHS were, if we remerge them back together, and this negates any other increase in costs from other factors or just inflationary pressures. By just remerging them, it would increase the small group market premiums by about 7%, close to $30 million for small employers. So we have elected to unmerge them permanently, and that's what this bill is. There's some technical corrections as well. Committee voted on this last week, and the vote was 11-0-0, and it's going to be, again, up for action tomorrow, read by, or reported out by Representative DeMars.
Any questions on that one?
Oh,
This is so easy.
Hi, I'm Representative Deratori, representing Washington 2. I'm just curious about what we're expecting to happen in DC as far as the individual assistance? And what would that look like for the individual market here in Vermont?
Well, I'm happy to talk about that, but I want to stress that this bill, regardless of what we do with this bill, it doesn't affect what's going to happen. So the advanced premium tax credits through the federal government are set to expire on December 31st of 2025. Without action by Congress to extend those, they would revert back to what the tax credits were prior to, the COVID expansion that they did. And that would have a significant impact on the individual market. I think, and I'm sorry, I don't have the numbers in front of me. 65 million. Yeah, it's Vermonters receive approximately $65 million to pay for their health insurance through the individual market. And I think 80 or 90 some percent of Vermonters who purchase on the individual exchange receive some form of tax credit. We don't know what Congress is going to do. There's no crystal ball. But again, I think it's really important that regardless, this bill, that is going to happen either way, and this bill has no effect on that whatsoever.
Teresa Wood from Waterbury. So that was part of my question. So, because we don't know, what's going to happen in Congress, I'm just wondering about the decision to make this permanent as opposed to sort of a little bit of a wait and see to see what's going to potentially happen on the small employer market before making a decision to make it permanent. That's all.
I would say the decision to make it permanent is it would be unsustainable for the small group market ever to be remerged with the individual market. And there are things that we can do that can have an effect on the individual market, but we can't do anything for the small business market or the small employer market. We cannot, as a state, we can't make a decision that we're going to extend credits. We can only do that to individuals. We have certain, absent of what Congress does and what the federal government does, we have mechanisms that we could employ for the individual market, but we have nothing that we can do for the small group market other than keeping them unmerged. Oh, yes. So, and both of the bills I'm talking about are need to be moved fast. This needs to be done by March 1st and hopefully approved by the governor, because the insurance companies are starting their rates, setting their rates for this next year, and they start that process in March, and they need to have this information and need to know what the environment that they're dealing with in order to develop their rates.
Hi, Bram Klepner from Burlington, and if I may also respond to Representative Wood's question. When you merge the markets, it brings down the rates for individuals and raises the rates for small businesses. So the small businesses are subsidizing all the people in the individual market. And if we want to bring down rates for individuals, that's a decision we can make. But choosing to have one group of businesses provide the subsidy for individuals is unsustainable for the small businesses and is also unfair. So I fully support the permanent unmerging of the two pools.
And I will add that we're seeing the small group marketplace change with the rising healthcare costs. Employers, frankly, are getting to the point where they can no longer offer insurance to their employees. And that is leading to a little bit more uninsured Vermonters, and that's the last thing we want as well. Or they're leaving and moving into self-funded plans, which is, an ever-growing segment of the pie chart of insured Vermonters. Okay, so next one is H31. If you recall the prior authorization bill that we did last year, this is 2 technical corrections to this bill, or I shouldn't call them technical corrections. There was confusion when administering this, what exactly a primary care physician was. If you recall, there was a section of that bill that exempted primary care providers who defined by the blueprint as being exempt from having to do prior authorizations for a certain, for certain categories of services. And there was confusion through the summer over who qualifies as a primary care physician, who doesn't. And this is in a definition and a change that has been made, which is essentially making it that if you have contracted through an insurer and you have designated yourself, through the credentialing process with that insurer as a primary care physician, that is what makes you exempt from having to do prior authorizations. So we're making that change to it. And the other changes is there was confusion over whether or not if somebody happens to be insured in Vermont, but they are seen at a out-of-state facility or provider, whether or not the claims edit section applied to the editing of that claim that was coming from an out-of-state provider. And what we have done is we have cleaned up and added in language to make it clear that the claims edit standards only apply to providers who are submitting claims within the state of Vermont or who have agreements with out-of-state facilities providers where services are being provided possibly out of state. And we are voting that, well, we'll be voting on that tomorrow in committee. So I would assume that would be up for action on the floor on Friday.
Can you, Representative Sarita Austin from Colchester, can you just explain claim edits? I mean, does it mean that people can change a claim? or
No,
something? No, okay.
claims edits
Thank you.
are sort of the coding and the standards that apply when a provider is submitting a claim for service. And there are lots and lots of thousands of edits that take place to ensure that claims are coded correctly. And it's the mechanism that the insurance company takes when they receive that claim, usually electronically, goes through, sort of claims edit software to see if it's a legitimate claim or if it's coded correctly, essentially. Okay. Thanks.
Great work by the healthcare committee, focused obviously one of our top priorities where we can to make healthcare a bit more affordable. So helping the small business group market here. And then the bill we passed last year, which was really groundbreaking and one of the first in the nation to help reduce provider burden, and just making sure, that we're going back over legislation that we've passed and that it's working the way it's supposed to. So these 2 housekeeping corrections will get us further to that goal. And now we're going to bring up Representative Wood and potentially Representative Shy, maybe not. Representative Wood to talk about the childcare.
Good morning, everyone. So I just wanted to provide some background information on Act 76 Child Care Financial Assistance Program and the changes that we made and established in expanding our child care program over the last biennium. And the reason that I wanted to do that was because I'm sure that you all are getting emails from constituents talking about the governor's Budget Adjustment Act, which we'll be voting on shortly, that deals with about $26 million or so of changes there. So the first thing that I want to say is that there are no permanent cuts to the Child Care Financial Assistance Program. The base budget, that's the budget from which future expenses are paid from, is not being cut. There's two things happening, but I want to focus on the program first because I'm sure that some of us might need a refresher and others might not even know what the program did, what the bill did when we passed it. And then we'll see if anybody from appropriations is here. Okay, so the first thing to know is that over the course of the last 18 months, we've been expanding eligibility for child care financial assistance. And eligibility now, as of October 1, 2024, is at its full level, and that's at 575% of the federal poverty limit. So we have moved from a program that really only assisted very low-income individuals to a program that assists really mainstream Vermonters and middle-income Vermonters that were struggling to pay for childcare in as much as an extra mortgage payment every single month and more than a mortgage in some cases. So that was a big deal. And that expansion just started happening in October. So the rollout of that is continuing to happen. So essentially the uptake in terms of what we've budgeted for in the general fund is a little bit more than what is actually necessary to meet the requirements of the current caseload. Another important fact, because last year we had some discussions back and forth with the administration about this because they proposed the same sort of one-time adjustments. And we put in place a process where there is a joint agreement between the legislature, our joint fiscal office, and the administration about what the forecast will be for expenses. It's the same thing we do on the revenue side of things. And so we said, because this is new and it is vastly changing what the program has been historically, that we felt we needed to have a consensus forecast about what the expenses will be. So that process is in place now. The JFO agrees with the calculations that were done. And so that's sort of I guess what I would call a safety valve for us as legislators to ensure that our legislative intent is being met. The other thing to know is that childcare providers, so what you hear from some of the advocates is that childcare providers, we could use the money to invest. We could use this money to invest in childcare providers and doing some of the things that we'd like to do. It's one-time money. That's one thing to remember. It's not ongoing increase. It's a one-time money. So, things they're advocating for things like, one-time supplemental payments to childcare providers, bonuses, things like that. I do want you to know that in 2024, we provided $20 million in one-time funds for that exact purpose. And we did that in anticipation of implementation of Act 76, where we have considerably raised the rates being paid to providers by 35%. And we have not left behind home care providers, which had a large disparity between what we paid center-based providers and what we paid home-based providers. And we reduced that disparity by 50% in the legislation as well. So we have been doing the things that Act 76 lays out. We will be continuing to take testimony in our committee. And the one thing that I just wanted people to be able to share with their constituents, that as an entitlement program, and that is something that changed last year. The budget bill made it an entitlement program. So regardless of what's appropriated, like a medical benefit that's an entitlement, the government needs to pay what it has agreed to provide. So Any of the changes that are happening are one-time in nature and are being utilized for other things that are in the Budget Adjustment Act. And just because there's a big ticket item in my committee, part of that money is going to the bottom line that will assist nursing facilities. We have over $50 million in payments going out to nursing facilities to sustain them during the course of this fiscal year. So it all levels out. Families are being taken care of, providers are being taken care of, people will receive their services. Anybody who new signs up, they will receive their services. It's not just existing people. So I just wanted people to be aware, be able to answer those kinds of questions that you get from your constituents. And at the same time, those funds are being utilized for priorities that exist in human services as well.
Questions for that?
The chair of appropriations is going to arrive momentarily, so she can give you the mechanics of the $13 million that are happening in both of these funds. There she is.
Sean Sweeney, Chittenden 7. Teresa, you said there was $20 million that was given out that was appropriated once for like bonuses. Just explain a little bit like where that went and what that looked like.
Sure. It was payments made in FY24 to essentially help providers hire on staff because there was going to be an expansion of eligibility. They were called readiness payments, so they could build capacity for infants and toddlers, for instance. That was something that we have really don't have sufficient capacity in our state for infants and toddlers because it's a higher cost group of children to serve. They could improve facilities. They could expand their hours of operation, things to give bonuses to staff, all of those kinds of things. They could jumpstart any increases in salary that maybe they were going to be able to make as a result of as the implementation rolled out when they received their 35% bump up in rates. So all of those things were eligible. You're welcome. All right, I'll turn it over to, here she goes.
So Representative Wood walked us through the program, and if you can just walk us through the mechanics of why the money is not being taken out of the budget.
Okay. So I'm sorry I missed everything until now, but thank you. So if I repeat anything Teresa said, so I'm thinking that Chair Wood talked about the fact that this is an entitlement program. So that means that everybody who qualifies will get their money regardless of what we do in the budget. So there are two pieces to the budget adjustment. They both happen to be just about $13 million each, and that adds to the confusion. I'm sorry, they aren't two different numbers, so I could explain that. The first 13 million is a reduction due to caseload utilization. So the program has been started, the uptake, and we expanded eligibility in October. The uptake has not been where we had put money in for. It's not necessarily less than we projected because, in fact, we had an idea that we were going to be putting more into the program than we would actually need for fiscal year 25. And in fact, that's what's happened. So we do this with Medicaid. We do this with all kinds of entitlement programs. Every year, a couple times a year, we look at the caseload and the utilization. And if the number goes up, we add money. If the number goes down, we reduce the money. So that's all we've done in the budget. I think it was last year when we did this, we also put in legislation that there needs to be a consensus revenue forecast and a consensus expense forecast. So our joint fiscal office has been part of this. And the feeling is when I've talked to them that they were pretty conservative about the uptake, meaning they thought they projected more uptake than they actually think they're going to have. So they felt very comfortable with that 13 million. The other $13 million is being spent. It's just not coming from the general fund. So part of what we've done is we've put together a child care special fund, and that's where the funding for child care is going to continue to come from. We put $8 million of general fund in there last year, and then we started the child care payroll tax. And again, the consensus revenue forecast has actually come in higher than what we put in the budget by just over $13 million. So because it's higher, rather than using general fund, we're using money from the special fund because we have more in there than we thought was going to be in there. So those are the two pieces. And I'll just add a third piece. I don't know if Chairwood talked about this or not, but I had talked to Finance and Administration Management last week because we were talking about doing some sort of a special reserve fund to make sure that we have money for childcare in other ways. We often do that sort of thing, not just the special fund where we use our expenses, but a reserve fund in case there's any problems. And they said, let's use the Human Resources Caseload Reserve Fund, which already exists and has a lot of money in it. And so without us having to put more money in it, we can draw from that if the situation ever arose that people who are eligible and we didn't have funds in the child care fund. And we're going to look at down the road how we would access that and how. So there'll be some language in the budget adjustment probably about how we would use any other special reserves. So I hope that was clearer than mud a little bit, but I'm happy to take any questions.
Hi, David Durfee, Shaftesbury. You mentioned the 13 million twice, two different 13 millions.
Yes.
Can just for context, and maybe this was a number that you mentioned earlier that that Teresa did, but what's the total dollar amount that we're expecting over the course of a year to be coming into the fund and going out to? I don't want to put you on the spot, but
I don't know. I almost feel like that would be a Ways and Means question. There were projections. I mean, I have the 80 to 90 million. Thank you, Charlie. So quite a bit. Okay. And I see Rebecca Holcomb has a question too.
One of the things I'm hearing about from constituents is concern that the payroll tax was explicitly established to raise revenues for childcare and the childcare subsidy. And there was a lot of concern around that particular choice of a funding stream. And what they're now saying is that they're very concerned that we're taking monies that were specifically raised for childcare and potentially making them fungible. And they feel they want to know if we're going to honor that commitment.
No, we can't do that. It's actually against the law to take money from a special fund that's designated for something and use it for something else. So we won't do that. We can't. I won't let that happen, but we can't do it. Yes, please. I hope that's clear.
Yeah, you're not going to let that happen. That is clear. Great. Thank you.
All right. Thank you all.
Yeah. All right, that's it for today. If you have any questions on any of the bills or topics, please see members of the committee or leadership